Hi, guys, it's Dr. Sadaf, and I would love for you to like and share this podcast and make sure you leave me a review. I'd love those 5 stars. So please, when you send me a review, please make sure to put the 5 stars in and to share the episode with somebody that you know that could really use it. And I would absolutely appreciate it. Also, if you're looking to schedule an appointment with me, make sure you go to my email and put your name on the email list. You will be the first to know when I open up my office in spring of 2024. It's drsadaf.com. And last but definitely not the least, September 16th to the 23rd, 2024, I will be hosting a retreat with Dr. Basma Faris in Morocco. You will be getting yoga and coaching, and we'll be doing excursions and cooking and spa and hammam and all of that great stuff along with meditation. So make sure you don't miss out. Spots are limited. So go to the link in my bio in both Instagram and TikTok to make sure you register. Enjoy the show. I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi, and this episode is everything you need to know about inherited beliefs surrounding intimacy. But before we get into it, I want to make a few things clear. One is that I am definitely not giving any type of medical advice. So if you have any questions about your health, please speak with your friendly neighborhood healthcare provider, and definitely not giving religious advice either. So if you have any questions about your religion, please speak with your friendly religious leader. This is a Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I have on with me Dr. Maiysha Clairborne. And Dr. Clairborne, please, for people that may not know who you are, feel free to introduce yourself.
Hi, thank you, Dr. Lodhi, for having me on. As said, I'm Dr. Maiysha Clairborne. I go by Dr. Maiysha, and I'm a family practitioner by training, integrative medicine specialist. But my background is in psychology. Always been fascinated with the mind, and I really help people with their thoughts and beliefs, inherited thoughts and beliefs, to get rid of their inherited thoughts and beliefs so they can create relationships and careers and a life that they really truly design. So that's who I am. I am steeped in psychological safety. That is one of the things that I love to talk about in trauma and trauma-informed interactions and communication.
Right. Well, that sounds fantastic. So I'd love to get into the topic. So today we're going to be talking about how our inherited beliefs impact our intimacy and surrounding, and how they really help us guide our relationships. So I'd love to get into that.
Yeah. Well, I mean, I think that the first thing to do is to really define like what intimacy is. I mean, I know that's your area of expertise. I think that people have these various mental models of what intimacy is, and how we get those mental models is really by what we see growing up, by what we see in our society, by what we see in the media. And so we talk about, first of all, what is intimacy? You know, we have to define it, right?
Yeah, absolutely. Absolutely. So there's so many different types of intimacy. And I think people sometimes pigeonhole intimacy into just the physical intimacy. And we know that there's experiential, there's intellectual, there's emotional, there's physical. So a whole bunch of different types of intimacy when we talk about intimacy. So I would think that all of our beliefs and the way that we think and the way that we were raised would impact all of those things.
Absolutely. Absolutely. And I love that you parsed out and distinguish all these areas of intimacy, because I think you're right. What people often think about intimacy as physical or emotional, but people don't often think about the intellectual aspect of intimacy. And so in social intimacy, and all these various aspects of intimacy that there can be, because really all it is connectedness and closeness.
Right.
And it's that feeling of safety. Right?
Mm-hmm. Absolutely. Absolutely. So how do you think that our beliefs kind of help us to frame what we see as intimacy and our relationships?
I think when we're growing up, what we see around us, and I think the very first people that we see tend to be the people who are raising us. It could be parents, it could be grandparents, it could be aunties, uncles, it could be foster parents, whoever those first grown-ups are who are raising us. We will get a model of intimacy, and then our beliefs will be formed around what we see. Because as children, especially in that first 10 years of life, we're sponges. So we're learning through watching. And so it may not be something that's specifically taught, but something that's just modeled. And then as we get older and we start to see other models of intimacy, then we begin to map on what it looks like in friendship, what it looks like in media. And I think oftentimes media, like movies and television, can give a very distorted view of what intimacy should look like. And so all of these things inform what makes up our own mental models of intimacy. And then we go into relationships with that model, and whoever we're in a relationship with has their own model of intimacy. So, even that influences and shifts and changes and molds what our beliefs are about intimacy. And then we have to then pack in our experience. So then maybe we have an adverse experience with being close to someone. Our beliefs get then shifted and changed and formed by that as well. So there are so many factors that pour in and play into how we form these beliefs about not only what it's supposed to look like, but even how to cultivate it or how to facilitate it, if that makes sense.
Yeah, absolutely. Absolutely. So, I agree with you 100%. Oftentimes I'll tell, I don't have any daughters, I don't have girls, but, I think it's really important for me to model for my boys, what a relationship can look like and how to interact with your partner. I always tell them that, one of the most important things that I stress for them is that whenever they become older and decide to get married and this and that, is to find somebody who they respect and respects them. I think respect is one of those very important things that is so important and key in a relationship. And I think that the way that parents model relationships for children is a lot of times what children will end up looking for when they look for a spouse, right? And I say that to my I have some friends that have girls, and I think that, I tell them that how they treat their daughter. So, if you're a mom or a dad, but however you're treating your daughter, that's what she's going to look for when she looks for a spouse. So if it's an interaction between, say, her father and her, however the father is treating that girl, that's what she's going to end up looking for when she looks for a spouse herself, right?
Absolutely, absolutely, and I believe the same is true with sons. I'm also a boy mom,
Yeah.
and so I'm always modeling what it looks like to create a healthy connection, because there is that distinction as well. There's this intimacy that's healthy intimacy, and then there's intimacy that ends up being codependency. And,
Yeah.
that's a whole entity in and of itself. And so it is important to model that healthy interaction.
Right. Absolutely. Absolutely. And I think that, I think it can be tough sometimes, but I think it's very important because we often see that, women that end up getting into abusive relationships, it has a lot to do with the families that they grew up in and what they saw growing up. So, for example, if a woman grows up seeing, domestic violence in the home, then that may be what she expects when she gets older and is in a relationship, right? If she experiences the same thing, that might be something that she thinks is normal, as opposed to being in a relationship where, she saw love and encouragement and, a lot of those other things. And that may be what she expects for herself. What do you think?
Well, so as a child witness to domestic violence, what I'll say about that is that it's one or the other, right? So you either expect it or you completely avoid it. And I think that's what
Mm,
kids tend to do. They either end up going in the on the same path, or they're endeavoring to go on the opposite path. But a lot of these choices end up being at the unconscious level. So while I grew up watching a certain thing and I said, I will never tolerate that. I will never, right? But I ended up in relationships that were not physically abusive, but subconsciously kept choosing people for a bit of time that were maybe emotionally or psychologically abusive.
mm,
And so
yeah.
when I was able to connect the survivorship of trauma and do the work, it shifted my view or my expectation around intimacy. So
Mm,
I think that it's important to understand that sometimes it is an unconscious choice. I mean, there's some consciousness about it. And a lot of when our kids go out and they're looking for relationships, it is unconscious what they're attracted to.
mm. That's so interesting, right? That you don't think about just the right, because domestic violence can be so many things. It's not just the physical, perhaps hitting or something like that. It can be emotional, it can be financial,
Mm-hmm.
it can be, psychological abuse, any of those things, right? Any way that another person can control you
Mm-hmm.
is really what the oppressor really looks for. So, really interesting that you bring that up. And I think that you're absolutely right. I think that oftentimes when people are, I guess, maybe the byproducts of a dysfunctional relationship, right? They may gravitate toward that. So tell me, how would you suggest, or what are some tips that you give your clients when you realize, or when they realize that perhaps their past beliefs or the way that they were raised are really affecting their relationships and their intimacy? What are some key things that you tell them to do?
Well, so whenever I start to hear these patterns in clients or in the people that I work with, I have them look into, what is the source of this? And oftentimes there is sort of an underlying trauma that is there. And of
Mhm.
course, I always recommend that person works with someone who is trauma informed, a therapist, a trauma informed coach, someone of that nature, because while we like self-help, sometimes self-help we need more than self-help. We need the professional help. And I was actually sharing with a mentor the other day. I was like, I think mental health professionals, therapists, should be primary care rather than this sort of thing that's reactive or secondary or tertiary care.
Mm,
So the first thing I do is I have them to look to see, like, is there trauma in the background? And if so, that's the place where you need to look to heal that trauma in order to shift that view, right?
mm,
When I'm talking to people about creating intimacy in relationships, I think what's very important is getting connected to the body, and what getting connected to the body and what feels safe and what doesn't feel safe. Because I think the
yeah.
intimacy, there's safety involved in being vulnerable and being open, feeling safe to feel like you can be your full self all the time, feeling safe to feel like you can make mistakes, feeling safe that you can express yourself and not have those words being used against you. So to look out for those things. And those when you feel in your body that twinge of uh-oh, something doesn't feel right, to trust that
Mm,
because that could be our brain or our nervous system telling us, trying to protect us and saying something is wrong. Or if you're working with someone, it could be something that reminds us of something that was wrong in the past. So I think that it's important to understand the root of repeated patterns of problems in relationships, especially problems with intimacy of any kind, to determine what is the underlying root cause of it, and where's the trauma that has the
yeah.
belief be the way it is.
Yeah. I love the fact that you said that, you feel that mental health providers should really be primary care. I agree with that 100%. I think that, so many people, and me included, for a while, used to think that, mental health therapists were a luxury, that, not everyone needs it, and that, perhaps it's just something that, you know, people get just when they're like, super rich and they have nothing else to do, and that's what you see on the media and stuff, right? That, oh, it's just these one off and people don't really need that. But as I've gotten older, I've realized, and I remember speaking to my friend who's a psychiatrist, and she said, really everyone should have a therapist, because you really can't offload on all of your issues or whatever is bothering you on your family or your siblings or whatever else. I mean,
Yeah,
or you may not even have that kind of support system, right?
exactly.
So really you need somebody who is not related to you, that you can talk to and tell the things that are bothering you, and then perhaps they can help you work through whatever it is that you have going on. Maybe it's trauma in the past, maybe it's a bad relationship, maybe it's that you, like you said, you find yourself in these patterns where you're in these bad relationships over and over again, and then you think that perhaps you deserve this. Or maybe it's something else, like you think you're a bad person and so you only deserve bad relationships or something like that. Whatever, whatever a person may be thinking. And so to unpack all of that, you really need a licensed professional that can help sort through all the baggage, right? All that you have, that you carry around with you, so that you can move forward in your relationships and promote intimacy and have intimacy that feels good,
Yeah.
that doesn't feel like it drags you down.
Absolutely, absolutely. And I think, like you're right on point. Like one of the things about therapists, mental health professionals, they have a listening. They have a very specific listening. They know how to listen in a way that most of them, well, I'll say now, the therapists that do their work, I should say. Right? And I want to
Right.
distinguish that, because I have come across therapists who, they may be bringing their own trauma to the relationship. But
Right.
most, so that I just want to make sure, because I know I've had some people who say, well, I've been to a therapist, and this, some of the objections, maybe I've been to a therapist and that didn't work for me, or they made me feel worse. You have to find a therapist. Creating intimacy in relationships is it goes the same with therapists as well. You have to find a
Right.
therapist that you connect with, that you feel safe with. And
Right.
so, but they do have a specific listening. They're trained to listen in a way and to be able to give feedback and help you work through things in a healthy way. Whereas you may or may not have family support, but even if you do have family, they may not be trained to listen to you in that particular
Right.
way. They're already
Right.
biased because they're your family or your.
And they always want to give advice.
Yes, 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 and your friends too. I mean, they like maybe like protective, and so they're going to be for you. They're not that objective and sort of neutral listening that most times a therapist is.
Yeah, yeah, and I agree with you 100%. I was taking this course through the University of Michigan on sexual counseling and education. We had tons of therapists in there. It was to become a sex counselor, a sex educator, or a sex therapist, and that's part of my training. So, but I had therapists in there that were learning to be sex therapists, and what I found is just the way that therapists talk, I feel is very affirming. And then also that they were able to hold space, right? We as clinicians, and, we're always looking for a solution. Like patients come to us, they want to, diagnosis, they want a treatment, they want a diagnosis. We don't really just sit there and listen, right, to them. We're always just trying to treat them and get to the next patient. And I felt like with therapists, they really do hold space, and they just really listen, and they really want you to unpack, but also to kind of work things out in your own head, right? And they give you that time to reflect,
Yes.
to see why something may be a pattern in your
Yeah.
life.
Yeah. And I want to say something about what you said earlier. I think sometimes therapists, like culturally speaking, and I can speak for my culture specifically, that getting therapy equals something bad, right? So
Yes,
there's like a
yes. right? That there's something wrong with you, right?
Right.
Like you're crazy or
There's like
something.
a
Yeah.
stigma. It's like something's wrong with
Yeah.
you. You're
It's huge.
crazy. We got to sweep that under
Mhm.
the rug. So culture. So I think that that is another reason why people don't reach out. Like it has to be that there's something wrong to reach out with a therapist. Whereas I think we're
Yes.
moving into an age where mental health check-in is becoming
Yeah.
more of the norm. So normalizing having a therapist to check in about, relationships that you have that maybe they're going well, but maybe there's a little twinge in the back of a little fear of this or a little that, and you can work through that and create an even healthier version of that relationship rather than there's got to be something wrong that we make right. And I think when we start to shift our view around how we think about interactions between people. Oh, it's good. How could it be the best version of that? Oh, that
Right.
my intimacy or my safety or my whatever that is, that connection is good. How can it be the best version of that? How can you supercharge the intimacy in that relationship? And what would that potentially do? When we start to think like that, then the therapist, the sex, practitioners, educators, in the sex therapists, they'll be able to help us even more at a deeper
Yes.
level.
I agree 100%. I mean, when I've mentioned in the past to perhaps like friends or somebody, that, you should really see a therapist or you really need some help, working through this, whatever it is, the trauma or grief or whatever you're experiencing, you really need help to kind of work through that. The response sometimes that I'll get is, well, there's nothing wrong with me,
Mm-hmm.
or I don't need that, or why do you think I need a therapist? I don't, I don't agree, whatever. And there is definitely this antagonism,
Mm-hmm.
right? That perhaps I think there's something wrong with them.
Right.
And that's not the case at all.
Mm-hmm.
When I suggest or whatever, if somebody were to suggest to me that, you should talk to a therapist, I would think that, you're right. I do need to talk to somebody that can help me work through my feelings. And, I'll be honest, I have a therapist and
Yeah.
I think everyone should.
Mm-hmm.
I think we all have, things in us that perhaps are holding us back, or things in us that we never worked through
Mm-hmm.
when we were younger. And now, now that we reflect, maybe it's time to talk to somebody about it, right?
Yeah. Yeah. I mean, I have a therapist that I've had for, a couple of years now. And we actually I just had a session with her and it was nothing but good things to report. But I told her at the end, I was like, look, just because there's only good things to report doesn't mean you're going to get rid of me, because
Yeah.
I need to check in, whether it's quarterly, whether it's monthly, if I'm having some challenges and we need to bump it up to weekly. Like, you're a part of my official team. And especially because of the work that I do, especially the work that I do organizationally with equity and anti-racism and all of those things that I do in activism, there is a lot of vicarious trauma. And
Yeah.
then of course I'm a single mom and I'm parenting. I got my one and only. So there are things that come up as a parent. And I want to be able to have my therapist, to be able to just click and say, hey, time for an appointment. Hey, I need to check in. And even during that
Absolutely.
point where I begin dating again, it's like, oh, hey, we need to talk,
Yeah.
you know? And
Yes.
so I think
Excellent.
that even when you go to you have your sessions, you may go to the session and have nothing but good report and have, progress. And that's
Yeah.
great. It's just like when you I actually had a dermatology appointment, my annual, and she's like, everything's perfect. Like, that should be the kind of relationship you could have with
Right.
your therapist as well. Sometimes there are things to work on. Sometimes it's progress and good reports.
Yeah. Yeah. And you know what? I think it's fantastic when it's a positive report, right? It's so funny, right? When patients come to us and they'll come in for like their ultrasound report or their, mammogram report, and you tell them everything looks fantastic. There's nothing wrong. They're actually disappointed. They're like, well, then why am I,
Why am I here?
why am I having this pain? Or why is this there? Or what? But I thought I had this, and in my head, I'm like, wow, I thought you'd be happy that there's
Right.
nothing
Right.
wrong. But I agree with you. I think that it's so important just to check in, just to have that person there to help you work through, what beliefs you may be having and how they're impacting your life and how they're impacting your relationships. And 100%, right? The beliefs that we carry, the beliefs that we were raised with are what kind of carry us through. They make us us. But at the same time, if they're not serving us, then perhaps it's time to question those and then ask us, what about the way that I think right now is hindering me from moving forward in my life?
Absolutely.
And I see that a lot in people that perhaps grew up in a culture or where they were taught, where they grew up with sex negativity.
Yes.
And so then, for them, sex is wrong, it's shameful, it's dirty. And we see it exhibited in, or it's something that, is taboo, you don't talk about. And then we see that when people then go ahead and say, they get married. And in Islam, we don't have sexual relations outside of marriage. So it's only within marriage. So then when they get married, then they carry those negative thoughts with them, and then it exhibits in their body. Like you were saying, where does this show up in your body? And it shows up as vaginismus, or maybe premature ejaculation, or maybe, erectile dysfunction. It shows up like that. And then you go on and you have like these unconsummated marriages, and then, their families start wondering what's wrong, and then they can't have children. And then they go through IVF to have their children. It's so many things, right? And so it's really important, I think, to kind of check in on yourself and in your own thoughts and to figure out, where are my beliefs holding me back and how can I move forward?
I love that you brought that to the forefront, that we live in, I think in general, we live in such a sex negative society. And it's either sex negative as if we're taught that sex is bad, or the way that it's portrayed in media is violent, is exploitive. And so that even brings subconscious messaging in. Body negativity is very related to that, I think, as well. And so it's very interesting that, based on different cultures. I mean, I know that in my culture, talking about sex, I remember not getting the sex talk growing up.
Oh, I never did.
We didn't talk about sex, And I think about now, like, with my son and myself and his father, and I'm thinking, we're gonna sit down and we're gonna have that talk, and his dad will have a particular talk with him, and I will have a particular talk with him. But we never had. Now, luckily for me, luckily or not luckily, we had sex education, so we did have the sitting in the room with the slideshow of all of the sexually transmitted diseases. I mean, but that's about as much as it was. There wasn't any other talk about it. So I think that you're right. Like, that ends up playing out inside of relationships, inside of marriages, especially when people carry sexual trauma into their marriage, or when there are certain things that are considered taboo from a sexual standpoint. And so if a person enjoys this certain thing, that, maybe they're a sexual deviant, and they carry this belief about themselves. So all of that plays into it. And I love that you brought that up, because when we start to have these problems, we have to dig into that too. What specifically are your beliefs about sex? What are specifically your beliefs about, physical touch, and what has when did that start, and what has happened to have, created that belief?
Absolutely. I mean, there's so much, that there's good, but then there's also sometimes people have a lot of trauma that they carry with them. It could be abuse, it could be molestation, it could be so many things, bad relationship. Perhaps there was something without consent, lots of things that could have happened. And I think that, when you talk about sex education, I would actually, say that, and I've said this actually in a few podcasts, is that the sex education here in the United States is really based on your zip code. It depends on who's controlling your board of education and what they decide should be taught. We know that in certain states, that the focus is more on abstinence. The focus is on pathologizing sex. It's on talking only about diseases and how not to get pregnant. It never focuses on consent. It doesn't focus on pleasure. It doesn't focus on other things that are important for sexual education. And also, we know that because our lawmakers feel that they can regulate women's bodies, we know that we've had so many reproductive refugees that have had to go from state to seek care, whether it was for a pregnancy that they didn't want, or whether even just for an ectopic pregnancy that could kill them if it ruptures. But because lawmakers don't understand what an ectopic pregnancy is, and and how it's really impacting the lives of women. So much there with even in terms of sex education. But I think it's important to realize that how we grow up affects our beliefs, what we learn, when we're children and then get older, how that affects our beliefs, and how our sex education impacts our intimacy later on in life.
Absolutely. I love how you distinguished how sex education occurs in the US, because you're right. It actually perpetuates the sex negativity, the sexual education that's currently in the United
100%.
States, whether it's preaching abstinence, or whether it's preaching how to not get pregnant, or only showing the diseases. Because that's exactly what it was for us. It was like only showing the diseases, right? These are all the bad things that could happen if you have sex, right? It worked for me for a period of time. That's for sure. Like I stayed abstinent for quite some time after seeing those pictures, but
I'm sure
that doesn't educate on how,
correct.
on really all of the breadth of what sexual intimacy does entail.
Yeah. And to advocate for ourselves and to give us that sexual agency so we can advocate for ourselves, so we know what we like, what we don't like. So many places in the world do not have sexual education, where women and men, both, not just one gender, but both the genders are not, they don't know their anatomy. They don't understand how things work. And then they come up with their own beliefs and their own thoughts about what it is. And so you and I could go on forever.
That's a deep conversation.
Absolutely. Absolutely. So, any parting tips that you would tell somebody on their beliefs, and if they're holding them back, what suggestions or pearls would you leave somebody with so that they can improve their lives and move forward in their relationships?
I would say question your beliefs. Question all of your beliefs, and especially the ones that are not serving you. Like when you think about what you believe, is that belief actually serving you? Is it actually, or do you feel it's actually harming you? Right? Is it working? Is it not working? And then start to look at when did I actually start believing that, and is that really true?
Sure.
Yeah. So that's the biggest thing. And then the second thing, of course, is what we've been talking about a lot, which is consider getting yourself a therapist or a coach.
Yeah.
To really begin to expand your belief system.
Absolutely. Yeah. I love that. And I think it's really important to really assess our beliefs, because if you feel like you're stuck in your life, then just think about that. Take some time, maybe take a walk, maybe do something where you're able to reflect and find out where you're stuck in your life, and how your beliefs are impacting that, and how can you move forward? Do you need a life coach? Do you need a therapist? Do you need somebody that, is going to teach you to really work out your thoughts and how those are showing up in your relationships and in your different facets of your life, right? It could be your work, it could be anything. Yeah. But how are our beliefs holding us back, and how can we move forward? So I love that. Thank you. And so for people that are listening and watching and wondering, Dr. Maiysha Clairborne is fantastic. How can I get in touch with her? How can I follow her? How can I work with her? How can they work with you?
Absolutely. Well, if you are wanting to delve into your own belief systems and release old negative belief patterns and old negative emotions, then you can find out a little bit more about the work that I do at mindremappingacademy.com, mindremappingacademy.com. You can have a free discovery call with me, and we can talk about ways that we can, move you through those limiting beliefs and patterns. If you want to just learn a little bit more about what I talk about in the world of mind remapping, you can listen to the Black Mind Garden podcast. So that is my podcast, the Black Mind Garden. And finally, if you want to follow me on social media, I'm on Facebook, Instagram, and LinkedIn, at YouTube as well, / Dr. Maiysha. All of those are / Dr. Maiysha.
Awesome. Amazing. So, well, thank you so much for coming on. I really appreciate your time and the knowledge that you shared with us. So thank you.
Thank you, Dr. Lodhi.
And it has been real and really intimate. And of course, this was not meant to be any type of medical advice. So if you're having any issues with your beliefs, your thoughts, please seek help. And remember that there's always hope and you can always get help. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.